6:54 right now. Some women with a high risk of developing breast cancer will seek out risk-reducing measures.
Yeah, for women with a specific gene mutation, one option might be undergoing a preventive mastectomy.
There are actually two genes that have been identified called the breast cancer genes.
These genes, BRCA1 and 2, are designed to protect against breast cancer. However, when there's a mutation in one of these genes, the protection is reduced.
If you have the first this BRCA1 gene mutation, you have about a 50% chance of developing breast cancer within your lifetime. If it's BRCA2, it can be about 40%.
Just because you have a gene mutation doesn't mean you don't have options.
Because of the very high risk, a lot of patients are advised that they need to do either very frequent screening and monitoring.
For women who want to reduce their risk further, they may choose to have a mastectomy. In 2013, Angelina Jolie underwent a double mastectomy for this exact reason.
Bilateral mastectomies reduce the risk. They don't get rid of it entirely, but they reduce it down to less than 1 or 2%.
Following a mastectomy, many women choose reconstruction.
Because we're trying to reconstruct the body back to its normal state.
There are several options to do this, the most common being implants, and another involves using your own body tissue.
Using your own tissue is a great option because it's yours. If you gain weight, it gets bigger. If you lose weight, it gets smaller. It kind of fluctuates with you, and it does all the normal things that gravity does to skin and tissue.
Dr. Shale says his goal with reconstruction is to make women feel confident about their bodies.
And not everybody is a candidate for all of these procedures. So it's important to talk to somebody who does them regularly so that you can have a good option for you.
More than 75% of breast cancers are not genetic. Just because you have a strong family history of breast cancer, though, doesn't mean you have one of those gene mutations. You do have to have the test for it.
And if you have more questions, join us for today's Ask the Expert. Intermountain will be here from noon until 5:30 to answer all of your questions.